Hi, everyone, and welcome to Doc's Thoughts. I have a very special local guest today, Eliza Andrews, and I have known her for years.
A long time.
I mean, I feel like ever since I started getting into integrative medicine is when I was first introduced to you.
Probably.
And now we have a good relationship in terms of our referral system. Yeah. So we send a lot of our patients at Wagner Integrative Health to her practice. She is a physical therapist, but beyond that, she's a pelvic floor therapist. She does integrative dry needling, or is certified in integrative dry needling, and she is the owner of Inspirit Therapy Associates. Correct. So she has a big practice with many different modalities. And what I wanted to do, the reason I wanted to bring her in is because when we send our patients to her, they get a different kind of an experience, because a lot of times people have pain or discomfort, and we think it's all because of the structure and the muscles and the tissues. But what I've found in my practice, and I know you obviously agree with this, is that a lot of that pain can be related to their nervous system. It can be related to their traumas. And so she goes at it a different way, and we get really good results for our patients. So I wanted to bring her on and kind of talk about what you do and why it's different from other practices.
Thank you. Well, and I can say that the thing is mutual, right? Because when I need somebody that's going to look at it a different way and do something a little bit different, I'm sending them over here.
Right.
So I think it's the thing that's different for what we do. So I've been a physical therapist for over 30 years, and all PTs go through the same training, all PTs go through the same education, then it just depends on where you're going to take your training from there. So one of the things that I learned early on, especially once I started working with pelvic health therapists or patients, is that that pain is different. And then people who've had chronic pain, or people who come in and they're like, why does my whole right side of my body hurt? Like literally just one side or whatever. And they come in with these unusual things. And we tend to get people who've been a few other places, tried a few different things. They're probably seeing multiple providers. And I'm like, okay, there's something we're missing. So about 20 years ago, I dropped down into a real deep dive on the nervous system.
How did you do that? Through your own personal study, self-study?
Some studies, some classes. There are other therapists out there, colleagues of mine, that really have put together really good resources, and then things outside of the therapy world. I did a couple of classes in psychology. I started taking some classes to become a sex therapist, not because I wanted to be a sex therapist. It's a great overlap, and there aren't enough of them in the world, so to be able to help our patients that way is huge.
Yes.
But mostly because I really wanted to understand the psychological component, and when you start thinking about what the psychological component does to the nervous system and how our brain runs everything, it was like really clear to me that we have to address the nervous system from a total healing standpoint. So, and that has to be done physically, has to be done nutritionally, has to be done with correct kinds of nervous system training. And most people don't realize that you can train your nervous system.
Right.
And then I just got really fascinated, and I was really blessed to work with an OT in my practice about 10 years ago. And she was really into that and really understood it. And so we, as a duo, did a deep dive into how to use the nervous system training in our practice, how to actually include that and just incorporate it so that when our patients are doing their physical therapy stuff, they're doing more than just leg raises and squats.
Right.
Yeah.
And so did you see a big change in patient outcomes once you started bringing that in?
The first thing was everything got faster. So it's not that we weren't getting people well, we just weren't getting them well as fast. And then more, and we started seeing, I would say, a more totality. Like patients would come in and be like, not just my back pain is better, but my everything.
My overall life is better.
Right. Yeah. So and then it's like, well, once you get those kinds of results, you're just going to keep going.
Right.
You're like, okay, I need more.
So when you're working with patients, are you upfront with them at first, talking about them with the nervous system, how we're going to be working with your nervous system and your physical body?
Yep, day one.
And they're probably all over the board, but sometimes they're probably very confused by that, I would think. Or do they accept it pretty well?
They do. The thing that's interesting to me is, so our initial appointments are really long.
So how long?
An hour or more, depending on the patient, which is a little different. The other thing is all of our treatments are done in private treatment rooms. So you're not out in a big gym. So we
Right.
can get really, people can, I think they can be very open and they can share what they need to share. And that helps. And we educate. And we explain to them, here's how your nervous system works and here's why it's so important and how, it's a two-way street. Your brain tells your body something, your body tells your brain something, and you've got to make sure that those two are communicating clearly. And once we start explaining it, light bulbs just start going on.
Right.
And we talk about nutrition, we talk about sleep, we talk about lifestyle management. Sometimes we're the first one who will ask them, like, so when you're stressed, what happens?
Right.
Or when you've had something not great happen, what happens? Or how do you feel when things are going really well? And all of a sudden they're like, oh. And we'll say, like, you got through your daughter's birthday party without pain because it was a happy day.
It was fun, right?
It was a happy day, versus the same amount of physical activity doing something you don't like.
Might
Not so
hurt.
great, right?
Right.
And then when you start putting those pieces together, they go, oh, yeah. And it's interesting, in this country, as you well know, we've gotten to a far amount of people using medications to try to control their emotional status.
Right.
And those meds, those mess with the nervous system
Right.
on so many levels. And so many patients don't want to be on those.
Right.
And so when we start talking about the nervous system and how those pieces go together and how their mood affects their pain and why, we talk about serotonin, we talk about cortisol, we talk about all that stuff, and the pieces just start clicking. So.
Well, and it's interesting because I was just talking to my daughter about this last night because she's graduating from college, starting a new job, so has the appropriate amount of, anxiety surrounding all these new changes coming up. And I said to her, it's interesting because a lot of kids in your situation would run right to taking a drug to just like quiet down all of those things. And I think our society has become one that the moment you become uncomfortable and you don't have all of the good feels all the time, it's like, oh, is there a medication for this? And I'm not knocking antidepressants at all because or
they have a
anti-anxiety
place.
medications because they
have a place.
absolutely have a place.
Absolutely.
But I think that there's a large amount of over prescribing of these things just because it does make it easier just to deal.
Right.
But do you find that patients who are medicating, it's harder to get into their nervous system and actually heal it? Because they're fairly blocked?
It is. And so the other thing is there's a lot of really great research that talks about how exercise combats anxiety and depression.
Yes. It's probably the number one reason why I exercise every day.
The amount of chemical changes that happen in your body and how positive they are.
Yes.
And so, so they come to physical therapy and they expect exercises. But nobody wants to do them.
No.
And so then you're like, okay, but not only is this going to make your body part move better, which means it will combat your pain physically,
Right.
but it's actually going to change your nervous system in such a way that you're going to feel better. And so when we tie those together and there's a double benefit, they really understand. And the right kinds of exercises do that much more efficaciously than the wrong kind. So, while some people get a runner's high by going for a 5-mile run, not everybody does.
Right.
So for some people...
And some people might be so high in their cortisol that that's just going to...
the wrong thing for them.
Yeah.
Yeah. Me.
Right. No, I can always tell with myself, I'm like, is it a good day to run? No.
Yeah.
You just need a long, slow walk.
Right. And the other thing is that if we tune in the nervous system to the purpose of the exercise, that's what we treat. That's what we train right away.
I love that.
So as we start working with people, often their first set of exercises when they leave our building is how to relax.
Right.
It's how
Yes.
to breathe. It's how to find your breath, how to coordinate your breath with what your body is trying to
Yes.
achieve, learning how to appreciate tension and what that tension causes. And when I say, that's all of us, it's everyone on our team does this. We're really lucky. Carrie Van Lannen is an occupational therapist who specializes, she's a certified professional trauma specialist. She is a heart math practitioner doing actual biofeedback where she hooks someone up with little sensors and she watches how they breathe, how their heart moves, what their heart rate is. So the heart rate variability is really big predictor of
Right.
how our body's going to respond to something or is responding to something. She puts them through all of that and then she starts teaching them how to consciously change their heart rate and their breathing rate to bring their emotional status under control, bring their pain down, improve their body awareness so that they can realize when they're actually doing things that are causing them pain.
Right.
So we have that. Every single person on the PT and OT side is trained in monitoring heart rate and breathing rate. We're all trained to look at that and to make people tune in. And, you know, so many people, when they're struggling, they try to dissociate and tune out.
Yes.
And they don't want to pay attention and they don't want to listen. And it's scary to come back inside a body that you don't feel good in.
Right.
So we just explain to them why we're going to do that. We tell them, you know, here's how we're going to do it. We're going to do it little bitty bits at a time. We're going to go slow. And then when they come in, it's every time they come in, every time they come in, we reassess and we're like, okay, what worked for you? And they'll be like, this worked and that worked. And, you know,
it's different for everyone.
It is. Mm-hmm. We talk about sleep a ton. Everybody gets a sleep management program when they're with us, all the way from our itty bitties, because we work with infants, all the way through our, 90-somethings. Mm-hmm. The shift work people, that's always a challenge.
They're difficult. I know.
It's always a challenge.
I know. You have to dance around that.
Yeah, beginning in their routine, simple things like... not anybody who comes from here. We don't ever have to fix this with them. But sometimes we get people and they're taking magnesium, but they're taking it in the morning.
In the morning, I know.
We're like, okay, let's just take that.
I get that all the time.
Yeah. Or their probiotics. They're taking those in the morning. Okay, let's take those at night. Let's talk about shutting off screens, and let's talk about breathing, and let's talk about awareness, and we'll teach them about weightless. I don't know if you even know that. That's there's a clinically studied. It's a song, I guess, but it's a naturescapes kind of thing. It's called Weightless by Marconi Union. You can download it for free. And it's legitimately, they did a whole study and they compared it to Xanax, and they saw anxiety levels be almost the same.
So it has something to do with I know I interviewed a producer who creates music based off heart coherence. He uses different beats.
It's all about the different, the sound rates and the...
and it brings you to different stages.
Correct. And then it also has the different, frequencies. Mm-hmm. So it's got a lot of brown noise. It's, it was really cool because I was playing we do colored noise in our clinic depending on what we're trying to do for background. So we do a lot of brown noise because that brings people way down in their autonomic nervous system. So while you're doing therapy, we've got that in the background.
Right.
And it just sounds like static.
Right.
But one of my 13-year-olds, she's so funny. She has a lot of anxiety. She goes, it's like what Tundra Lodge would sound like without the kids. Because it does. It sounds like waterfalls.
Oh, it does.
It sounds like the crashing waterfalls.
Right.
It's that low rumble, like that shh, that kind of sound. And I was like, wow. I'm like, that was pretty, like she locked into that.
Right. Your kids can catch the most amazing things.
They think about it so differently. But what was great about that was then, we got her a machine. And she listens...
to play in her house.
To play at home.
Yes.
And she's diagnosed with like ADHD, whatever. And so we actually have her do pink when she's studying, and she does brown when she's feeling a little edgy. And we have a whole color scheme. And her mom and dad said, it's an amazing change that we've seen.
I'm just making notes so that I can tag these. So the song was called?
Weightless.
Weightless? Okay.
Yeah,
and then you said there is a specific machine you buy or is it just tracks that you download?
No, we actually there's a machine. Of course, it's off of the Beast that I don't like to say it out loud, but
I can put it at the end of the show. I'll put it in the notes so people can look into it.
Yeah, they can actually we have all of those links on our website too. So if they want to go look at our website and see what we have, awesome. And then we have some protocols on there too where they can look at.
Oh, excellent.
Yeah.
So when you identify someone who comes in and you right away say, oh, their nervous system is not in homeostasis.
Yeah,
it's not
say
balanced.
jacked up.
Like obviously you do things manually to them at that moment. But what kind of things do you have people when they're leaving? So like obviously you probably identify people who need some like significant psychiatric or psychological work. So you probably find someone for them for that.
So we do. The biofeedback, the heart math machine, the biofeedback machine can actually be purchased and you can be trained to use that at home.
Yes.
So we do.
I had the one that was like the sensor on your ear for a while.
Yep. So we have the ability to send them home with one if they want. And we have units that can go out and they can, they can take those home and
then
use
return
them.
it.
Yeah. Well, and they can get their own, which if someone really wants to do
They're
it,
not that expensive.
they're under $200
Right.
and we can give them a discount.
Yeah. All right.
So that's really nice. The HeartMath lets us do that because Carrie's a certified practitioner with them. And then, but it's just even like learning how to put their hands on themselves and feel what their body's doing. We'll do that. We'll talk about positional release, why certain positions are better for certain kinds of relaxation. We will talk about all the sound stuff that's important. We'll talk about the different ways to move. Like before you go to bed, there's right ways to move and wrong ways to move. When you get up in the morning, so yeah, it's a lot of education, and we try to do it little bits, and we try to do things that are integrated through the whole day, so that we're like, when you feel this, you can do this, even if you're at work, even if you're at school.
Yes.
For our kiddos when they're at school, and especially with our young kids, excuse me, because like Carrie will work with kindergartners that are having a hard time, and their days are really long. And so we'll work with our education teams, we'll work with their parents, of course, and we'll just help them find strategies. But I think one of the neatest things that we do is, I have to count, 1, 2, 3, 4 of our practitioners are trained in visceral manipulation.
Yes.
Which
I love visceral manipulation.
Yeah.
Tell
it's
people
amazing.
what that is first, because a lot of my patients are like, what are you talking about?
It sounds, and I hate the name.
I know.
Because it sounds like I'm going to reach in there and do something aggressive.
Right.
It's a really gentle technique. We put our hands on. It's 7 grams of pressure. So it's very light. It's barely the weight of our hands. We put our hands on and we feel for the way your organs are moving. So we can do your pelvic organs. So your bladder's huge. The bladder and social anxiety are that's that organ, right? When you have social anxiety, your bladder is going to be crazy.
Interesting.
When you are nervous, not specifically social, your stomach, right? How many of us have felt that?
Right.
Or when we're angry, that's our liver, for sure. And so each of our organs has an associated somatic connection to emotion. And that's well documented. If you think about it, if you've ever read a book where they've said he felt the bile rise up in his throat, right? Even authors know that,
right.
That feeling of...
But I would say the whole organ thing, when I first started getting into exploring alternative things, and there would be practitioners that would be like, oh, I can feel your liver, and I can feel the valves, and I was like, that's just a bunch of bull. And I was so blocked about it.
Yeah.
And now every one of my patients who has gut issues gets referred for visceral therapy. Yeah. Because it's amazing.
So the difference is that it's how, and I'm going to pick on you a little bit.
No, you should.
Because you have a background in
emergency medicine, right.
Okay.
I'm like, let's just get her done.
Well, emergency medicine doctors are pokers. You guys are it's got to be so fast that you plow through you miss all the tissues.
Yes.
And the other thing is when you push on a tissue, it pushes back.
Yes.
Right? And rebound aside, you're not going to feel what's going on. So
I felt nothing.
Right. So we have got people really comfortable. We put our hands on really lightly, and then we just wait. And the body just it's kind of like...
It's energy.
Yeah, and it's energy, but it's actually it's what that nervous system is doing, right? It's those impulses from the nervous system protecting the body first, and then you got to communicate with it. And our tissues are meant to glide and shift and move. And when our tissues have been traumatized, whether it's by infection, inflammation, physical injury, or stress,
or adhesions,
any of that kind of stuff, surgeries, whatever, any of that, they stop moving. And when organs stop moving, they're not happy. Think about it. If you're in a crazy busy place, but you can move, you're fine. But when you're tucked in in a mosh pit and you can't move, don't you get just a little nervous and a little unhappy?
Yes.
So visceral manipulation is just finding the organs in their spot, and that's all based on anatomy. So we really, when you first start doing this work, you deep dive into where anatomy is. You have to learn that between, third way down the left side clavicle, midway between this rib space and that rib space, that's where you're going to find this, you know, and that, it's really specific. It always screws me up when somebody has an atypical anatomy and I'm like, all right, what I'm looking for isn't there. Then I have to feel around and then I ask them,
Or if it's absent, if they've had taken out.
Well, we had a girl once who came in. I couldn't figure out what was going on with her. She was like 16, and we couldn't. And she has a lot of stomach problems. Whatever. We couldn't figure it out. She went in. She was flipped.
She was.
Yeah, she was. Some of her anatomy. I was like, okay, I'm not crazy. Like I couldn't.
You felt that. That's incredible.
I didn't know what I was feeling.
So for visceral therapy, I would always think that's mostly for patients who have like IBS, chronic constipation.
It's for everybody.
So you would do that everyone?
Well, it depends. I mean, it depends on their level, but everyone benefits from it. So you have more nerve endings in your GI system than you have in your brain, right? So if we're going to go back to the nervous system, and I want to change what the nervous system is doing, I can do that through the gut. So putting my hands on, it sounds weird, but on your belly, near your belly button, and mobilizing your small intestine, I can improve the serotonin that's made in the small intestine. Because now those organs are moving. When they move, they pump. When they pump, they create more serotonin. So when I've got somebody who's overall feeling of like kind of malaise, they're a little bit depressive, they struggle this time of year.
But you can read it right in their eyes when they come in.
Yeah, and the seasonal affective thing. So I'll put my hands on their belly, and they'll come in and they'll be like, I had so much energy.
You get all the gurgling that happens when you start, right?
And patients apologize, and I'm like, don't apologize, I did that on purpose.
Anytime I get any kind of body work and my stomach starts moving, I'm like, oh yes,
feels so
it's
good.
working.
Well, and the other thing is that, like, from a whole body standpoint, if we're not expelling stuff, right? So if we're not going to the bathroom, if we're not having good poops,
right,
our bodies are miserable.
Right, toxic.
Oh, we're holding all of that.
Right.
Or if your liver isn't detoxing. So going in and I love this. We do our liver lift, but person sitting, I just put my hands right under the rib cage. They just fall forward, and I just stretch all those ligaments. It's really gentle. It's their body. Most patients, when they get done, they are like, oh, I feel so light.
Yes.
I feel so... and then the one thing about visceral that is always really just so compelling to me is patients will come back, and I don't tell them this most of the time. It depends on the patient. Most of the time I don't tell them that they're going to have an emotional release with this.
Yes.
And they'll come in, and I'll say, so I didn't tell you this because I don't want to set the stage.
Right.
I don't want anybody to anticipate something they may not get. But I'll be like, you might have been a little I went home and I cried. And I'm like, yep.
That's good.
And they're like, and it felt so good.
Yes. Oh, that's wonderful.
Or patients who go home and say, I was mad, but I wasn't mad about anything.
Right.
I wasn't mad at anybody. I just felt mad. And I said, how long did it last? And they're like 15, 20 minutes. I just felt like, and I'm like, and then I felt amazing.
Right.
And so what I tell patients when they're leaving is I tell them to honor what their body's going through. I said, if you feel like you want to take a nap, take one. If you feel like you need to eat something salty, eat it. If you feel like you need to drink a ton of water, of course, we tell everybody to do that.
Right.
But like, whatever you feel you need to do, if you want to go for a walk, if you need to just be quiet and be by yourself, listen to that, because that's your nervous system tuning in, maybe for the first time in a very long time, to what your body really needs.
Right.
And then you go, and they'll come back, they'll share that, and then that opens a doorway to, well, what other patterns is your nervous system looking for?
Well, I think so many of us are so tied to a schedule, like even on the weekends, that even you can't even take the time to be like, okay, body, what do you actually need?
Right.
Because you're like, I have to have this meeting, and I have to get this thing done, and then I have to get this, everything. And I'm not saying that that's reality, like that's our lives. Like I run by a schedule, but it's carving out the times where you can just check in with the body and be like, what does it want right now?
Right. And we teach that too.
Yeah, because that's something that was a huge game changer for me. I mean, going from being the ER doctor, young kids, like everything was just constant fight or flight, and then realizing that, oh my gosh, my body has been trying to tell me this for 10 years, and I just wasn't listening.
Well, and the difference between, and when we explain the nervous system to patients, and we're explaining that there's the two stages, the fight or flight and the rest and digest. And when we start breaking that down for patients, and they're like, I'm never in rest and digest.
Never.
No wonder you don't go to
plow all day long, and then I take my Xanax to go to bed.
Yeah.
That's the reality for some people.
Yeah.
Not judging it, but I'm saying that that's like a little bit of imbalance in your nervous system.
Yeah, and it affects everything, because the nervous system does run every system.
Right.
So nothing can be right when your nervous system is struggling.
No, and I think that's a good segue into the pelvic floor the stuff, because a lot of my patients struggle with libido issues. And part of me is like, you know what, that's just the natural aging of a female. Like, your body is not going to reproduce anymore, so it's not desiring that action that's going to make it reproduce. But a lot of it also is, if you're in constant fight or flight, your body also doesn't want to be in that reproductive mode. It's not going to be relaxed. It's not going to be aroused. It's not going to have that interest, because all the energy is focused on the emergency that your body thinks is going to happen.
Right.
So you guys do a ton of pelvic floor therapy.
We do.
I mean, I feel like that was your
Well, that's my thing. I was one of the first board certified pelvic health specialists in the state of Wisconsin.
I'm not surprised.
Way back in when.
Because I remember back in the day thinking it was kind of weird.
Yeah, well, it definitely was weird. So, and I've been at it
Which
since
is crazy, because
since
now
I graduated.
it's so normal.
Well, yeah, and it's really gratifying now. So when I graduated from college, I shouldn't say only, but the start in women's health at that point was called women's health. Was, well, you're pregnant and you have low back pain, right?
Right.
But then those patients would come back to you afterwards and like, well, my back pain, they had their baby. My back pain is maybe a little better, but why am I peeing like all the time? Or why am I sneezing and peeing?
Yes.
And I was just in my first year out of school, and that got thrown at me, and I was like, I don't know, because when I was in college, we were told, well, if you're going to learn pelvic health, that's a specialty. You got to study that outside the classroom, afterwards, post-grad work.
Right.
So I did.
Thank God.
And now they're learning it in school, which
They
is
are
great. And
awesome.
they're actually, I have a student right now who is in her last clinical rotation, and she's doing great. So they're actually introducing it. And now, of course, so my first 10 years, I was really doing just women. I started in hospital systems, but then I did work in an OBGYN clinic here in Green Bay for a while. That got me a ton of obviously that's all I was doing.
Right.
For that whole time. And I got to see a nice variety, and I got to see a lot of things. But then I had a man walk in and say, well, my pelvis hurts. And I was like, oh, okay, let's start thinking about that. And so then I started transitioning into treating more male patients. I just got back from an advanced class that was all males for 2 days. So the libido thing is for them too.
Right.
I mean, they
and
get
erectile
that.
dysfunction.
And erectile dysfunction, yes. And we can treat both of those things as well.
I only was aware of this in the last, I would say, a year and a half when you talked to me about it. And, we can give them testosterone, we can give them Viagra or Cialis, but then...
Which please do, because that really makes my job
helps,
easier.
right. But then if there's also, when it's a man experiencing, let's say, erectile dysfunction, what do you see in their pelvic floor anatomy? What's the dysfunction?
So it's a blood flow thing,
Yeah.
right? So what can we do to increase blood flow? And a lot of times the blood flow is stopping somewhere much higher in the pelvis, or actually it can happen as high as the thoracic spine. So we actually treat all the way from the shoulder blades
Interesting.
down. And neurologically, a lot of people think that, yes, your sacral or lowest nerve roots off the spine go to your reproductive organs, but there are nerve roots on the sensory side that come all the way up at T12.
Interesting.
So we have to treat all the way down.
And do you see some good results with men?
Yeah. And there are some devices out there and things, and those can be very helpful, the shock waves and those kinds of things.
But those are just getting to the vessels right at the base of the penis, basically.
Correct. And they're temporary. The latest research that's out there is that has to keep being repeated.
Right.
And it's expensive.
Super expensive. I looked into getting it and I was like,
Yeah.
Unless its outcomes are this crazily amazing, I'm not
they're
going to do
getting better, but guess what? We can do it with therapeutic ultrasound.
Right.
So we have therapeutic ultrasound in the clinic, and it's almost as good. It's probably 80% of what shockwave.
So you're not delivering shockwave, though.
It's ultrasound waves. It's sound waves that do the same thing.
Okay.
So we use therapeutic ultrasound in the clinic for treating mastitis. We use it for treating lymphedema. We can use it for all those. It's the same idea, right? So it's a deep penetrative heat that dilates the blood vessels.
Same
so
thing.
we can do. It's the same thing.
Right.
It's just. And it's a lot less uncomfortable. Although shockwave isn't supposed to be uncomfortable. If you deliver it at the right, it's not supposed to be uncomfortable. But, and we do work with pumps. We do a lot of work with the penile pumps, which is really huge because you have to reestablish blood flow to the penis.
Right.
So if someone's had a flaccid penis for a long time and it's not working, so we'll work with the pumps. We'll teach them how to do the pumps with the correct exercises and
So
the
they have to
visceral
take
work.
those home.
Yeah.
Oh,
Yeah.
that is interesting.
Yeah.
And there,
So
I
all
don't.
that.
Is there anyone else in town?
I don't know.
And I mean,
I've been doing it for 20 years.
Right.
I don't know of anyone else in the therapy realm that's doing all of the things
Right,
that we're doing.
right.
Yeah.
Would you say with pelvic floor type situations that there's almost always a nervous system component involved?
Yeah.
I would think so.
Yeah. And again, we're back to that word somatic, right? That what the brain is telling the organs to do is a disconnect. And we talk a lot in all the classes, men and women, we talk about the identity piece of it, right? Like women identify their reproduction with their role as a woman. And we have to change that on so many levels. And men too, though.
Right.
You know, like guys, it's like, well, how big is it? And what can I do with it?
Right.
And there's all these different components. And so the psych piece is pretty big. And I've added a lot more. And I should say as a team, we've all added a lot more of that to our training. And being in private practice, we have a little more ability to do that.
Yes.
And those private treatment rooms really do come in handy.
Huge.
Yeah.
So you have, what other types of modalities are at your clinic? So we talked about the different forms of therapy.
Yeah.
You brought up the ultrasound.
So we have a high intensity laser,
Okay.
which is a class for obviously cold laser. Ours is at 15 watts. There are some out there that are stronger, but unless you're 350 pounds, you don't need them to be stronger
Okay.
because you don't have the tissue depth to go through, right?
And it's red light?
It has red light with it, but this one has got, I did a lot of research. So I've had laser in my clinic since 2004. So I started when we were in 3B lasers, and I've upgraded every few years as the technology has gotten better.
Right.
I'm pretty sure I was the first one to do laser at all in the clinic in this area. The machine we have is great because it does multiple hertz. So it'll do 830 or nanometers, excuse me. It'll do 830 nanometers, which is pain control. It'll do 1100 nanometers, which is edema control and fluid mobilization. And then it goes all the way up to 1300, which is where we get mitochondrial RNA synthesis, which is the fancy way of saying it helps the cells reproduce faster and make new healthy cells.
So you'll do that directly on an area of injury or discomfort. It's not like you stand in front of the whole laser and get your whole body
Yep.
lasered.
Nope. It's targeted.
Like targeted therapy.
Yep.
And then you guys do dry needling.
We do dry needling. So the dry needling that I do is a little bit different. I always love it when people come in and they're like, oh, I hate dry needling, but I'm going to get it done. I'm like, why do you hate it? And they're like, well, because it hurts. And I'm like, not the way I do it.
right?
So the dry needling that I do is I can do trigger point, and I will if it's indicated. But I'm certified in integrative dry needling, which is neurologically based. So, for instance, if your left forearm hurts, you have tennis elbow. If you do trigger point, they're going to take that needle, put it into your epicondyle, and they're going to move it around.
Right.
And it's going to hurt like a dickens. I'm going to needle you way up at your neck and follow that nerve path all the way from the C5-6 nerve root all the way down to your elbow. So you're going to have, 7 needles, but I'm going to just put them in along the nerve.
Right.
And I'm going to let them sit.
Right.
And I'm going to let them communicate with each other through the nervous system. And I take them out, and they're like, oh, that didn't hurt. I'm like, uh-huh. And my pain is gone. Uh-huh.
Uh-huh.
So I just like it. I just think it's way more comprehensive.
Would you say it's closer to how acupuncture works? That's what it sounds like.
Yeah.
Yeah.
Yeah. And the gentleman who perfected the system that I'm trained in is Chinese.
That's wonderful.
Yeah.
It's wonderful.
So, and I'm certified for pelvic floor, cervicogenic pain. So like TMJ, headache, all of that, face.
Anything neck.
Occipital nerve. Yeah. All that kind of stuff. We can do all of that. And then whole body. We even there's techniques to use it for performance enhancement. So like some of our athletes will come in and get that done before they have like big
An event or something.
races and stuff. Yeah, and there's a thing, do that with a couple of the D1 swimmers in the area, do that with some of the professional athletes in the area. So it's really fun. It's fun when they're coming in. It's like, oh, let's just see if we can make you better.
Make
at
you
what
better,
do.
right? Those are very fun.
Yeah,
I like those patients too.
Yeah, it's just a different spin.
Totally
right, than
different,
working with
right,
people who are in
right.
pain. But yeah, and so we have the lasers. We can do ultrasound. We can do electric stim, all the regular stuff.
And then you have the heart math.
And we have the heart math,
Which I don't think we actually told people what heart math is.
So that is that heart rate variability biofeedback.
It measures your it measures your heart rate
Correct.
variability.
Yep, and how you respond to things in the nervous system. We are trained the visceral manipulation, so there's 4 of us who are trained in that, and then there are 1, 2, 3. I count everybody. I think there's 4 of us as well that do craniosacral therapy.
Oh, wonderful.
And craniosacral is just another very gentle, very light, very comfortable that we do to mobilize the nervous system, to help the nervous system respond better to the
Through
environment.
manipulation of
The
cranial
cranium
bones.
and the sacrum, both. We can do it at the lower part of the
that
body.
makes sense, craniosacral.
Yeah, we can do both. Well, and actually there's 3 diaphragms. There's room we do, because you have a nervous system hub. Of course, your brain is one hub.
Right.
You have one just behind your sternum, and then you have one in front of your sacrum. So we can work through all of those different layers. I actually really love the sternal work, because like you get through to the thymus, you get through to the heart, and you just get those to move, and then just opens up that area.
Right.
Just really, people start to just feel better.
Right.
Yeah,
That's
because
incredible.
when your thymus doesn't move, that is going to make life really hard.
So when people leave the practice and you've given them all this information, what would be like 3 main take-home points that you give them to do homework at home? I know that's a vague question because you have
Yeah.
all sorts of different complaints,
Yeah.
but for the general public who's listening to this and they're like, hey, I just want to tap into my nervous system. I want to learn to like sit with it for a little bit. What would you tell them to do?
So the first one is find a place that you can tune in, right? Like you got to figure out what that is. I mean, it's not ideal, but sometimes we'll tell people, especially moms with little kids, we'll be like, go sit in your car in your garage.
Oh, for sure.
Because like, and you can lock the car doors and lock the door to the garage, that kind of thing. Or, go drive to the park next door or whatever, go. So the first one, find some place. And then it's just breathe. And then as you breathe, pay attention to where your breath doesn't go in your body.
Right.
Like, you take that breath and you're like, do you feel like it stops
Stuck
right here? And if it stops right, behind your breastbone, and you don't feel your lungs expand, and you don't feel your shoulders move, and you don't feel your hips tip back, and you don't feel that, that's one. The second one is your feet. So for anybody who's got anything going on, think about making your feet relaxed. If you have pelvic pain, if you have urge incontinence where you're like, feel like you're in the bathroom, or you are in the bathroom every hour and a half, right? Or you don't go to the bathroom really well, or you're just really, think about your feet being really relaxed. Picture them, if it's in warm water, that helps you with being in the warm sand.
Sandy beach.
Yeah, but picture your feet being just really, really relaxed. And that impulse will crawl right back up the tibial nerve to the sacrum.
I love that.
And then the sacrum just goes done. And my pain patients are like, what? But it's taking them out of thinking about what hurts,
right,
and moving it to somewhere else. But again, we're back to that nervous system. How is that all connected? And then the last one, and this is another one that's going to sound weird, but you can stimulate your vagus nerve. Your vagus nerve is a cranial nerve, which means it goes right from your brain to your body. It is the longest nerve in your body. It connects your lungs, your heart, your entire GI system, your kidneys, your reproductive organs, and it terminates in your pelvic floor muscles. So it goes all the way down.
It's a big deal.
It's a big deal. And it has components of autonomic and sensory and motor function, which is crazy, right? That it can do all of those things.
Right.
There's only one in your body. Most of our nerves we think of as being a right and a lefty, but this one's only a lefty. And it exits just behind your left ear. So you can mitigate what that nerve is doing really easily. So the first one we teach is tapping. Yep, so just really gently tapping right behind your left ear, or little circles, clockwise or counterclockwise, doesn't really matter. When someone's really struggling, we will teach them the ice cube. Put an ice cube right there, because the vagus nerve also is very temperature sensitive.
I'm so glad you just said this, because every time I cold plunge with someone, I'm always like, put your neck in the water.
Yeah, you gotta get to your ear.
You have to get that nerve in the water.
So my grandson, who's 2, when he was little, started doing that. When he gets really upset, he'll hold his breath and then pass out. He does the thing. And I told my daughter-in-law, I said, just put a ice cube behind, because she freaks out, of course, she turns blue.
Of course, right.
And she just puts an ice cube there. Like in 2 seconds, she puts an ice cube there, and you see him just, you see his nervous system just kick back in.
That's pretty cool.
So those kinds of things are really easy little take-homes. We'll also talk about, not everybody loves it, but lavender. You know, putting some
I think
lavender
lavender's wonderful.
in your diffuser or spraying it in your car. If you have a long drive to work and you get road rage, put something lavender in your car. You know, lavender.
Maybe just put it right underneath your nostrils.
I tell people to spray a little bit on their sleeve.
I should probably just wear it like this.
Because lavender is another thing that is clinically studied
Yes.
to be anti-anxiety producing. And in fact, in Europe, you have to fail a trial of encapsulated ingested lavender before they'll give you anti-anxiety medication.
Right.
Like that's a standard over
Right.
there. You know, so you're going to try lavender before you get a Pax or Xanax or any of those kind of meds.
So just to repeat, you said deep breathing,
Yep.
feel your feet,
Yep. Vagus nerve.
stimulate your vagus nerve somehow. I would say cold plunge if you can.
Yes, if you can.
Because I'm a fan.
Or a cold
Or a cold
shower.
shower or an ice cube.
And can we
or
just-
tapping or
And
gentle
can we
massage.
just talk for women?
Yes.
53 degrees is cold enough. Right? You don't have to go jump in the Fox River in the middle of winter.
We might fight about this one.
You know what? I don't know.
There's a lot of stuff about people being like, oh, it's not good for women to cold plunge in the colder temperatures.
Oh, I don't say cold. I don't say it's not good. I say we don't,
they don't need
have
it.
to go
100%
colder
agree.
than that.
Yes.
So it doesn't have to go colder. I'm
Yes.
not saying it's bad. I'm just
Okay.
saying we don't have to go colder than that. I think that the thought of it being like there has to be ice cubes floating in the water.
No.
That's
I 100% agree with you.
Yeah.
Like we keep our plunge here usually around 50 degrees.
Sure.
But then when we're doing outdoor plunging, especially if it's close
Sure.
to winter, it's usually in the 30s.
Sure. And that's okay.
And
I
it's
think
fine.
that's okay.
But some people have been saying it's not good for women. I'm like, oh, come on. I feel amazing.
I mean, there's a little. I mean, I think there's a little nervous system thing there
It
for
depends on
some
you.
people,
Right.
So you have to know what you're gonna
100%.
what you're going to do. So, I mean, if you have the opportunity, would I try it at that 50-degree mark first? Sure, because
Yes.
you get the benefit without the risk of your
terror.
nervous system being a little bit over, like going into a little bit of, you know.
Right. Like I actually have seen people who go in and they're panicking the entire time they're doing it, and I'm like, that was not good for you.
No, and that
It's-
didn't
it's-
benefit you.
No,
You didn't
not
get
at
what
all.
you needed. So
Not at all.
yeah, no, I agree. And cold plunge is fabulous.
Sauna.
And so-
You guys have a sauna.
We have an
here, too.
infrared
Right.
with chromocolor. So our infrared has different. We have infrared, but then we have all different color lights with it.
Right.
Yep.
And I always want to ask people, getting towards the end, so you've been doing this, you said, for 30 years plus. And I know it said on your website that you were initially an athletic trainer before you went to school for PT at Marquette.
Right.
So you've been in the body business for a very long time. What made
yes.
you want to do this?
Oh, very long, quick. I'll make it quick. When I was a freshman in high school, I had always wanted to do athletics, and my parents didn't allow it till we were in high school. And so I wasn't, and I still am not superly athletic. But I liked the track coach at my high school, actually at De Pere. It was Dan Baker, for those of you who are local. Everybody loves Dan.
Right, yes.
And I started running, and I developed big red, they still don't even know what they were, but basically some kind of masses, cysts on my feet and my legs. I had them for years. Nobody really knew what they were, couldn't figure it out.
Interesting.
But I couldn't run, it hurt. So he didn't want me to feel left out. So he said, well, why don't you become our trainer / manager? And so I went and met with at the time we had a high school trainer.
Right.
His name was Jim Pop. And I went and I said, well, Coach Baker said you'll teach me how to tape ankles. And he's like, not until you know anatomy and physiology.
Yes, right.
And so I was a 14-year-old freshman in high school, and I stayed after school every day.
And learn?
And instead of going to track practice, I studied with Jim for the whole spring.
Oh, that is incredible.
And then that summer, at the time it was it's traded hands now, but the clinic that Jim worked at sent me to a camp down at University of Wisconsin Oshkosh. I went to my first ever away from my parents.
That is incredible.
For a week, and studied there at a sports medicine camp. And then I came back and I was the student athletic trainer with Jim at De Pere High School, my sophomore, junior, and senior years.
That is incredible.
And then went to Marquette. And I wanted to be an athletic trainer, but Jim's back then in 1988, that wasn't a degree. So it was a certificate program. You had to do something else. And she
Right.
was like, well, do PT because then you can follow your athletes in the clinic.
Mm-hmm.
So I was like, okay. And I did all the hours and I took all the classes and I double majored basically. And I graduated and I realized that I didn't really want to work with athletes. I mean, I love athletes and I love working. I take care of the basketball team at Superior. Like, I love working with all of them. But I didn't want to do it full time.
Right.
And then I got out and I found out I just loved everything that PTs could do because we can do anything.
You can do so
like
much.
We have such a nice variety.
Yes.
And then the women's health thing caught me within my first year of practice.
That's amazing.
And I've been doing it ever since. And when I started, it was weird and nobody did it. There were like 3 of us in the state of
Right.
Wisconsin doing it. And then I moved up here and I had a chance to work for a couple of the hospital systems, started the program at one of them, really built out the one at the other, then went and worked in an OBGYN practice to get that take, and then very quickly got frustrated by all the limitations that being in a system puts on you. And I said, okay, do or die, here I am. So I started my own practice. About 3 months into that journey, found out I was pregnant with my 4th child, and I have a stepson, so number 5. And yeah, here we go.
That's incredible. And I know you're basically a lifelong learner. I mean, aren't you constantly doing certifications and courses and learning
Yeah.
new things
Yeah.
and enhancing
Yeah,
the
we have
experience
to.
for the patients?
Yeah, we have to. And I think that, like, I think any PT, I just was at our state conference on Friday, and we were talking about patients that have hypermobility spectrum disorders, right? So
Very challenging.
So we have a program for that at our clinic because we have a full POTS and dysautonomia program
Yes,
in
yes.
our clinic, which we were doing before it was long COVID. Like, we've been doing that for a long time.
Right.
COVID just made it kind of come out a little
Right.
more to the forefront. And I was listening to these 2 therapists. One of them is practicing about 4 or 5 years, and the other one's been practicing less than 2 years. And they were talking, and I was like, "Oh, you have so much to learn." Like, and I wasn't being condescending. I was just like listening.
No, you're
to
just like,
them,
oh
and
my
I'm
gosh,
like,
right? It takes time.
I'm like,
It
I was like
does.
not being condescending at all. I was just like, "Oh, you're gonna be so good at this because you're already good at this, but you're gonna be so
Right.
good, And every patient teaches us something. We work with, the biggest change probably for me after starting to treat males was treating patients who are going through gender reassignment, whatever place they're at. With that, we do that. I don't know if anyone else in town is doing
I
that.
don't think so.
But working with those clients, and there's so many extra challenges for them, and just making our clinic, I say we're going to be cutting edge. If there's something new or different, we always have to stay within our scope, but we're always pushing the edges of what is that scope and what can we do, and are we trained? So are we trained to do nutrition? Yes, we are. Are we
Right.
trained to do lifestyle?
Absolutely.
Absolutely. In our clinic, we have PT and OT. So what's really nice about that is you get 2 different perspectives coming at it from a couple different corners, and we can put our heads together and work really collaboratively. And everyone who works in our clinic has got so much experience, 26 years, 28 years, 30 plus years. We're just just an eclectically trained. We have somebody who's certified in lymphedema. We have somebody who's oncology certified. We have people who are blading cup. We do cupping. We do if it's out there, we want to find out about it. The only thing we haven't added is we haven't added the shockwave, but
Right.
we have so many other ways to do what the
I would agree
shockwave
with that.
does
Yeah.
for the cost. I mean, that's thousands and thousands of dollars.
Yes.
And we do take insurance at our clinic,
Right.
which is a lot of private practices have stopped doing that or never did that. We do take insurance. We take the Medicare, we take the Medicaid. So we just want to be able to, and we can't offer some of those things to people who can't afford to pay
Right.
them. And I don't like that. So we try to keep everything, as equal as we can for patients.
So if people are out there listening and saying, oh my gosh, I need to make an appointment, it's the easiest way? Obviously, if there are patients, we refer directly to.
Sure.
If they're not our patients, they just can find your website, which we'll link in the show notes
Sure.
very easily. I know that I've navigated it before with patients, like, hey, this is how you book your appointment.
Right.
And then typically then you guys will reach out to them and get it all scheduled.
Yeah, so the interesting thing is so the state of Wisconsin is direct access, which means that a doctor's note is not, a referral is not required for anybody.
Which is wonderful.
If your insurance requires it, we will help you navigate that and we'll explain that to you. The only exception to that is Medicaid patients are required to have a referral. So if you have state insurance, you do have to have a referral. That's their requirement. It's a Medicaid requirement. It's not ours.
Right.
But they can call. And then the nicest thing about calling is our front desk staff are really well educated on who does what.
Who to send the person to.
And a lot of people will call me like, well, I wanted Lisa. And I'm like, oh, you might not.
You might not, right.
Because I have such an amazing staff. There's 7 of us.
Yes.
And everyone has got extra letters and extra training. And depending on what you're calling for, you really might not want to be with me.
You
might want to be with somebody else because it's what they're really good at.
Right.
You know, and if you go with that person and you're halfway through your evaluation and that person thinks we need to swing, we swing.
We swing.
So we're not, it's not like your doctor's office where they seem to be a little bit, or like if you, sometimes you go to, especially to a specialty office, like, they don't want to share.
Right.
We share and we collaborate.
Yes.
And we work together and we powwow all the time. And we're just, because at the end of the day, we all have the exact same goal.
Right.
And I just told one of my patients this morning, there's no room for ego in healthcare.
No.
At all.
No.
And we, that's just, there's just not. So, they can reach out to us by phone call, or if it goes to the website actually comes to me. So I reach to it. It does, our website is completely private, doesn't go anywhere to a third party, it comes directly to us. So you can write in exactly what your call or what you want to know about, and we can respond to that email and then tell you who you're sending up with it. Yeah, and then we'll follow up. Yep.
Okay. Well, thank you so much for being on the show.
Thank you for having me.
And I guess more so, thank you for doing such an amazing job taking care of our patients, because from here we know that if we're sending them off to you, that they're going to have an amazing experience. Even if they're hesitant at first, they're like, they're gonna do visceral therapy. What is that? I'm like, just trust me, just go.
Yeah.
And because I know that they're gonna get far beyond just the visceral therapy.
Yeah.
Someone's going to be paying attention to their nervous system. Someone's going to be asking about their lifestyle.
Right.
Just opening them up a little bit to what true healing looks like versus just the Band-Aid approach.
Well, and the other thing is, for anybody out there who has pelvic floor, male or female, and you're like, if you Google it and it intimidates you, I promise you, there are so many things that we can do where you stay fully dressed.
Right.
You do not have to get naked.
Right.
Because like I said,
intimidating.
We can treat from up at the chest level, we can treat the low back, we can treat you from the feet.
Right.
I can make you stop peeing your pants with treating your feet.
That's incredible.
So, I mean, do I think pelvic floor is better if we do the pelvic floor directly? Yes.
Right.
But even for people who come in, they're just like, I'm just not there. Or if there has been some trauma, or you're a little bit nervous or whatever, or if you're like, I'm not sexually active, I'm not interested in that, all those components, pelvic floor, please don't be scared. I always tell people, we don't have a speculum. We don't shine a light on your bottom.
Right.
It's a completely different environment.
Right.
It's very, very different than your annual exam. So
Right.
please don't think it's like that at all.
No, that's good. That's good input. Well, I really appreciate you coming, and I hope all of you guys are able to experience their services. And put any questions on the show notes, because we covered a lot, and we covered it, I would say, not with a ton of depth, but just enough to give you a little teaser into what they do there.
Yeah.
And we'll see you on the next show.
Thanks.